Welcome back to the What's in Your Head podcast. I'm Pete Schultz, Doctor of Physical Therapy. Today, we're talking about persistent postural-perceptual dizziness. That's a mouthful, or 3PD. This is a condition where someone has a vestibular event like BPPV, vestibular neuritis, or a concussion, and even after the initial injury improves, they were left with ongoing dizziness, imbalance, and sensitivity to motion or sensitivity to busy environments. Testing is often normal, which can be confusing and frustrating. In this episode, we'll break down what 3PD is, why it happens, and how the nervous system can get stuck in this pattern, along with practical ways to start improving. As always, this podcast is for educational purposes only, and this is not a substitute for individualized medical care. Let's say someone has a vestibular event. Maybe it was BPPV or vestibular neuritis, maybe a concussion. The spinning or the vertigo sensation improves, but weeks later or months later, they still feel off. They feel imbalanced, foggy, dizzy, uncomfortable in busy environments. They start avoiding stores. They start avoiding scrolling on phones, avoiding quick head movements. They're not turning their head. Their neck is starting to get stiff. They go to the doctor. Tests are all normal. They're not seeing anything, but they're still having these symptoms and they still feel off. Then over time, the symptoms worsen and then they avoid more activities and then they're not going to social events. One explanation for this pattern is something called persistent postural-perceptual dizziness, or 3PD. And this is a nervous system issue. Again, your vestibular issue, the vestibular event, has improved and that has structurally gotten better and you've recovered from that. But now the nervous system is having a hard time processing this information. The brain is having a hard time speaking with the vestibular system and the rest of your body. Kind of all the wires, they're not in sync in your brain, vestibular system, musculoskeletal system, nervous system. They're not getting the same messages. What is 3PD? 3PD is chronic, non-spinning dizziness lasting more than 3 months. Dizziness is present most of the time and varies in intensity. But with people who are experiencing 3PD, they're dizzy all the time at some level. For pretty much the majority of the day, they're experiencing dizziness or feeling like they're rocking, uncomfortable in busy environments, uncomfortable with motion, and they feel it all the time. So when people come in and see me, and they have these type of symptoms, they might have had this event, maybe a concussion, maybe BPPV, maybe a vestibular neuritis months ago or years ago, and they feel better and they're not spinning anymore and they're not throwing up, but they're still off and they don't feel right and they're dizzy all the time. It's also worse with upright posture, worse with movement or visual stimulation. It's often triggered by a vestibular event like BPPV or vestibular neuritis. And people will often describe feeling of rocking or a swaying sensation, feeling like the floor is moving under them, feeling like they're on a boat. It's often described to be worse in grocery stores, in crowds, scrolling on screens, looking at a ticker for the business news. I get a lot of financial people that come in to see me, and when they're looking at the ticker with all the stock prices on it, they get dizzy when that busy screen is running. Or people who watch sports, these busy ESPN sports shows, there's a lot of boxes and there's things flying across the screen all the time. They have a hard time tolerating that. And they're also dizzy with head movements and walking. When they go to the doctor, the tests are usually normal. They get an MRI of their brain, it's normal. They do a vestibular evaluation and all their vestibular tests are good. They're able to stabilize their vision. Their balance is okay. Maybe there's a little bit of deficit in their balance, but overall pretty normal. Their hearing is normal. And all these tests are normal. But remember, with 3PD, you just don't feel right. You feel off. Triple PD or 3PD is not a problem of the inner ear anymore. It's a maladaptation on how the brain is processing and balancing the signals coming in or the inputs coming in. It can be present along with other inner ear disorders. You could develop 3PD when you have another disorder, or as that disorder is getting better, this one will still persist. And a lot of people, they feel unsteady. They feel like they might fall. They feel like they're this walking on ice type of gait pattern, though they're very hesitant to walk. And it's not necessarily anxiety or hypervigilance. It's really your brain having a hard time deciphering these signals that are coming in. There is some anxiety early on because you don't feel right and think something's wrong. But once you go to the doctor and get all these tests, the anxiety level usually comes down a little bit and you just don't feel right and you feel off. People who have this are often problem solvers and they're coping really well and they're trying really hard to fix this. We're finding that people with 3PD, they often overestimate actually how much they're moving. As a physical therapist, I'll do a balance assessment. I'll do a vestibular assessment on them. And when they close their eyes, they think they're swaying all over the place. But actually, they're just swaying a little bit. They overestimate how much they're actually swaying. So you have to kind of fine tune. Sometimes I'll do exercises with their eyes open, with their eyes closed, in different types of lighting environment. And there was an interesting study that showed that measured how much you move relative to how much you think you're moving at different heights. So it was really interesting. They did this study and they put people in all different heights. They put people on the floor and then at a low height and then at a high height. And they noticed that the higher you are on a ladder or on a platform, the more you think you're swaying. Oh, I thought that was an interesting study that people tend to overestimate when they feel like they're in a more dangerous or more unsafe environment. 3PD is actually a newer diagnosis. Before we called it 3PD, or I always have to look back on this, I get my perceptual and posturals mixed up. 3PD, persistent postural-perceptual dizziness. Before we called it that, it was called phobic postural vertigo or chronic subjective dizziness or visual vertigo or space motion discomfort. These are some of the other things. And kind of as a group, the scientists or the medical community got together, and now these have all been grouped together and called 3PD. In 2017, the Bahraini Society formally defined persistent postural perceptual dizziness or 3PD. And again, these are all describing all these other things, the chronic subjective dizziness and visual vertigo. They're all describing the same things, but we all had to come together for research to have a common language for these. 3PD is often triggered by a vestibular event. So that vestibular event could be BPPV, which is positional vertigo with the crystals. It could be a vestibular neuritis, a concussion, vestibular migraine, panic attack, a syncopal episode where you're fainting, maybe you had fainted for unknown reasons, or a cardiovascular event, or it could be from a serious illness or injury. And the thing to understand is the vestibular event starts the process, but you're in 3PD, you don't fully recover to your baseline. You never fully feel like yourself. Your crystals or if you have BPPV, we clear it, right? So you have those crystals in your semicircular canals. You go to vestibular therapy, they do some maneuvers, it clears it, but you're still dizzy. And you're still dizzy it's normal to be dizzy for a day or two after these maneuvers. But with 3PD, you're dizzy for the next 6 months or a year, and it never goes back to your baseline, which again, these situations, or this could be helped and this could be fixed. So the brain never fully turns off that alarm system. And why does the brain get stuck? The brain is always trying to fix something. So they see an error message and the brain is trying to fix that error message. So the brain kind of gets stuck in this protective, maladaptive strategy. And after the dizziness, the brain may be using your vision a little too much. So they're relying on vision. When you balance comes from three systems. It comes from your eyes, your visual system, your inner ear, the vestibular system, and your proprioception, which is the sensation in your feet and your muscles and joints. After some of these injuries, people become very dependent on vision and they almost shut off their vestibular system. When you're so dependent on vision, you're not using all your systems. And then maybe what if something happens to your vision? Maybe you get allergies or you get an eye infection or your vision starts to deteriorate for some reason, or you're in low light, then you feel very off balance. Now, this could set off a cascade of events. What happens when you don't feel right and you feel hesitant to move, you feel dizzy, you feel off, then you tend to move less and you tend to move your head less, because when you move your head, you get dizzy. Then moving your head less, your neck starts to stiffen up, and then you start to get neck pain and some tension in your muscles, and then you can't move as far. And then when you can't move as far, you do less activities, and then you start avoiding social activities and avoiding other things. And then all of a sudden your vestibular system gets weak or deconditioned, and then your muscular system gets weak and deconditioned, and then you start getting a little more anxious and scared to go outdoors and do things, and people just start moving less. And when you have anything that goes on with your vestibular system, people tend to move their head less and move their body less, and then that vestibular system gets weak. With vestibular therapy, we try to get you to move it. Even if you feel uncomfortable, you got to move your head and you got to do the things that make you uncomfortable, which I'm going to talk about in a few minutes, because the brain and your nervous system is treating this movement like a dangerous threat, and we have to change that. Some of the things that aggravate PPPD or aggravate this condition are busy environments like grocery stores, or scrolling on phones, or watching a very busy TV program or movie, walking in crowds, turning your head, especially quick movements of turning your head, and change of position, like bending over to pick something up, lying down, twisting, trying to get something off a top shelf or off a luggage rack. A lot of these things aggravate the symptoms that you're having and make you feel more dizzy or more imbalanced. So let's talk about treatment, some treatment principles for 3PD. I like to break the treatment into three pillars. The treatment for 3PD is a combination of vestibular rehabilitation or vestibular therapy, nervous system regulation or self-regulation, and graded exposure. Let's talk about the vestibular rehabilitation first. As a vestibular therapist, this is one of my specialties, and I see a lot of people. And with 3PD, the person has already compensated their vestibular injury, whether it is BPPV, people have crystals in their semicircular canals, that has already resolved and that has already improved. Or if someone has vestibular neuritis or labyrinthitis or another vestibular disorder, that disorder has already, the person has already compensated for that, or that's already been fixed, or it's no longer a structural issue. Now, what we're working on with vestibular rehabilitation is getting them back to doing the things that they're avoiding. A lot of times people, they get uncomfortable in supermarkets or movies or screens. They avoid them. So we have to make sure that we're doing these things. And even if someone feels dizzy, they have to keep doing them. And one of those things is turning your head. It's really funny when people have 3PD or people have any vestibular disorders, I could always tell when they walk into my office, they turn their whole body. If I stand next to them and say their name, they won't turn their head, they turn their whole body. So you could really see vestibular patients, you could really pick them out because the avoidance of moving your head. So the first thing we do is make sure you move your head. Even though moving your head is uncomfortable, I have these people come into my office, and the first thing we start with is turning your head side to side. I know this is an audio podcast, but I'm turning my head side to side. So really making sure that you are going to do these movements, and you'll turn your head side to side in the horizontal motion, in a vertical motion, in a diagonal motion. And we're really trying to adapt the vestibular system, because the vestibular system, if we think about it like a muscle, the vestibular system gets stronger when you turn your head and you move your head and you change positions. And if you don't do those things, it's like not moving a muscle, or it's like laying in bed all day, where if you laid in a hospital bed for 2 weeks, your muscles would atrophy and get weak. So if you don't move your head for a week or 2 weeks or 3 months, your vestibular system atrophies. So we have to get people to move their head. There's also exercises to get people to move their head and body and eyes. So there's visual motion exercises, and these are basically based on what your deficits are. Also, I'll have people walk in busy environments, and then we start off slow. Or if someone's having a really hard time walking in crowds or walking in supermarkets, I might just have them walk down their hallway, turning their head side to side, and then gradually add in some. Maybe they could walk with some music in the background, or some visual stimulation, or some lights, or some in an art gallery or something. You're slowly going to add in some visual stimulation. And then there's also other exercises like gaze stabilization and some other things that we do. The goal of vestibular rehabilitation or vestibular therapy is to get the vestibular system working harder. And the vestibular system that hasn't been working hard because people are afraid to move their heads, we need to get it stronger. The next pillar is nervous system regulation or self-regulation, which again, I can't stress upon this as being, this is just really important to do something to regulate your nervous system. And tools to regulate your nervous system would be like paced breathing, something like breathing in for 4 seconds and out for 6 seconds, extended exhale breathing, or the physiologic sigh. It's training your heart rate variability. We use heart rate variability biofeedback while doing breathing exercises to see what's the best way to regulate the nervous system. Oh, it's really important to see these things. So that's why I think biofeedback is very helpful, because we could regulate the nervous system, but we have objective data to see what the best exercise or what activity is the best. We're going to do relaxation training. We could do a combination of breathing to relax the nervous system, or we could do muscle relaxation, progressive muscle relaxation, which is a squeezing and tensing your muscles and then relaxing. And the goal of this is all to reduce the danger and to reduce the threat response, but also just calming of the nervous system and improving your heart rate variability. So using this, I find that doing self-regulation activities or exercises with biofeedback is very important, because you get that objective data to see what the best activities are for you. Then we have graded exposure. Graded exposure comes out of the cognitive behavioral therapy world. And graded exposure is more like in the stress, or people who are afraid to go back to busy environments, afraid to leave their apartment, afraid to go to grocery stores or movies, afraid to watch screens. We have to slowly introduce that. And when we introduce that, people are going to panic a little bit. And then when you panic, you're going to need some kind of tools to calm yourself down and create some safety in your system. Oh, what this is if you're afraid to walk in crowds, you have to ease into it. You start slowly, you pace yourself, you walk down a street that during a time that's not going to be as crowded. And then if that goes well, the next day, go a little busier time, and you're just kind of working your way in. These 3 pillars that I talked about, the vestibular rehabilitation is geared towards getting the vestibular system stronger. Self-regulation is meant to improve heart rate variability and calm the nervous system, get you more of that parasympathetic rest and digest part of your nervous system. And your graded exposure is going back to the activities that you've been avoiding and slowly getting back into them. Now, as a physical therapist, I also think the neck becomes really important. Now, the neck is the what I would say would be the last pillar. Oh, the neck in people who have vestibular issues, especially 3PD, the neck gets really stiff because people are afraid to move their head. Well, if you don't move your head because moving your head makes you dizzy, then eventually your neck starts to get stiff and then those muscles get tense and then you start to get cervical symptoms. So working on the neck and going to physical therapy or going to a chiropractor, going to acupuncture, doing something to get your neck to move more will allow for these exercises to be easier. So I think it is important to work on the neck. And when I do a case example and I talk about someone who's had 3PD and has gotten over it and recovered from it, then working on the neck was a big part of it. Postural exercise and neck exercises are important. Well, realistic expectations, it's important to know that with 3PD, the improvements are gradual. There's not a quick fix. It's not like BPPV where you have crystals in your semicircular canals and it's causing you to have vertigo and you could clear it and then you're all better the next day. There's gradual improvements. You will get better with a combination of vestibular therapy, self-regulation, graded exposure, and neck physical therapy, but the improvements are gradual. And the symptoms fluctuate. You may be doing well for 1 week, and then one day you have a setback and you're not doing as well. Oh, it's not necessarily linear. The improvement should be steady, but there are setbacks throughout their improvements and throughout your recovery. And like I said, recovery happens over months. It's not going to happen overnight. But with the right approach and with this approach, most people will fully recover from this. All right. Now I want to talk about a case example. A person that I had seen, I still actually see him every once in a while, but a person I had seen several years ago. And this person was 48 years old at the time I saw him. He is a physician. He does mostly research. I don't think he sees people clinically, but he does. He's an MD, PhD. So he's a medical researcher, very intelligent, very educated, very smart person. He had an episode of BPPV, which is positional vertigo, 3 years before he came in to see me, which cleared. He went and got an Epley maneuver, he told me, and it cleared and he was fine afterwards. It went away. They did the Epley maneuver and he was okay. And then 2 years later, he had another episode of BPPV. It may have been the other ear. He wasn't living in New York at that time, so I did not see him, but it was treated again with Epley maneuver. And then his spinning got better. The vertigo got better. But then he had this persistent dizziness that never really resolved after. Oh, the day after he had his vertigo treatment or the repositioning treatment, he still felt dizzy. He didn't have any more spinning or vertigo, but he felt dizzy. And then that low-level constant dizziness never got better, and it was always there. And he always said he wasn't spinning, but the dizzy sensation and the feeling of unsteadiness never went away. By the time he got in to see me, he was avoiding a lot of activities. He was fearful to go outside his home. He was actually using a cane to go outside, and he was afraid to get outside. He also reported that before he saw me, he fell asleep in a weird position on the couch. And then after he fell asleep on the couch, his arm he had some paresthesias, or he had some numbness down his arm, and he lost some dexterity in his hands and feet. And he started to become really dizzy. And now he had this thing with his arms and legs, and he was getting very overwhelmed. And he definitely said that he had an increase in anxiety and feeling of overwhelm. So he saw a neurosurgeon, and the neurosurgeon recommended a cervical fusion, which is crazy for that to be the first line of defense. But he said he didn't want to get that done at that time. He saw it more as like a last resort. He did not get the cervical fusion. Then he went in and saw a neurologist, and the neurologist sent him to physical therapy for neck and vestibular therapy. And that's when I met that's when I met him. When I saw him, I did my battery of vestibular tests. He did not have BPPV. He did have some balance deficits. He was overestimating his balance deficit. He thought when his eyes were closed, he was swaying a lot, but he wasn't swaying as much as he thought he was swaying. He definitely had balance deficits with his eyes closed. He had balance deficits with head turning. He was afraid to turn his head. His neck was very stiff. And we designed the treatment program for him. Oh, I wanted to work on his neck. The treatment program consisted of a combination of manual therapy to improve his neck mobility, posture exercises. He had a series of posture exercises that he did every day to help with his neck range of motion and his posture. We did vestibular habituation. We started vestibular therapy mostly working on his balance, head turning, and trying to get his head to move and trying to get him to do things that made him dizzy, because he was afraid to do anything that made him dizzy, including turn his head. He was never turning his head. So I really emphasize the importance of moving his head and moving his body, even if it makes him feel dizzy. We did breathing exercises with heart math and other biofeedback. With biofeedback, he did some HRV training. I think we did some box breathing and some extended exhale breathing with him. And after 6 weeks of one physical therapy session a week, and with him doing his home exercises multiple times a day, he was able to return to work. He was able to walk around the city. He got his life back. He felt better. Every once in a while, he would feel a little bit off or dizzy, but overall, he wasn't using the cane anymore. He was walking better. He felt better. He was more confident. And it also, that just feeling less dizzy made him less overwhelmed and less anxious. It took about 6 weeks of him steadily and consistently doing these exercises, but he was able to, what I call, recover fully. He was able to recover fully. Using vestibular home exercises, breathing techniques, somatic tracking for dizziness, regular consistent posture exercises, and some physical therapy on his neck, he was able to fully resolve and fully recover from 3PD. So the takeaway is 3PD is real, and it's a real, understood, recognized condition, but it really reflects how the brain processes motion and balance rather than any type of damage to the inner ear. A combination of vestibular rehabilitation, nervous system regulation, graded exposure, and neck physical therapy or neck mobility exercises and posture exercises can really help retrain the system and reduce symptoms over time. Oh, I hope you enjoyed this episode. I see a lot of people with 3PD and a lot of people who just don't feel right and feel uncomfortable after a vestibular event, and they just kind of don't go back to baseline. This is a treatable condition, and you can recover from it and get better from it. If anyone would like to learn more about vestibular conditions, you could go to Pain&Dizzy.com. If you would like an assessment for a physical therapy evaluation, you could find us on dynamicsportspt.com. Again, I hope you enjoyed this episode, and it's for educational purposes only. And I would hope that people wouldn't use this instead of going and finding the right medical care. And I will see you next time.